My next guest is here to talk about President Biden's vision for ending cancer as we know it. Dr. Danielle Carnival is Deputy Assistant to the President for the Cancer Moonshot and Deputy Director for Health Outcomes in the White House Office of Science and Technology Policy. Thanks for being with us, Danielle.
Thanks so much for having me. It's good to be back.
Well, I know we had you on last year at a Hill Health event, and you talked to my colleague Steve Scully. Great interview. You mentioned in that interview that, yes, research had been affected by COVID-19. So kind of update us. What has happened since then? What recent progress have we seen, and are we making up for that lost time?
Yeah, I think the answer is a resounding yes. Especially this week, the American Society for Clinical Oncology annual meeting is happening. And so we're live getting a lot of the updates on progress that's been made. The systems are back up and running and really robustly delivering on the goals that the president set forward as part of the Cancer Moonshot.
Let's talk about those goals. You have over the next 25 years some large goals. Can you talk about them, and what are the keys to actually hitting them? Do you have intervals where you're kind of assessing, okay, here's where we are at year 5 and year 10?
Yeah, so the President and First Lady reignited the White House Cancer Moonshot really to mobilize a national effort to end cancer as we know it about a year ago in February. And they set big goals. It's about building a world where cancer loses its power. A diagnosis isn't a death sentence. We prevent cancer before it starts. We catch cancer early so people live longer and healthier lives. And patients and families don't have to navigate their cancer journey alone. The goals were to decrease the death rate from cancer by at least 50% over the next 25 years, and to improve the experience of people living with and surviving cancer, their loved ones and family members. So while the kind of end part of that goal, the end timeline for that goal is out into the future, we know that we have to make progress year over year. Actually, we have to make greater than the most progress we've made year over year in order to achieve that goal. So this is not a let's just plan for a few years and we'll be able to meet it. We are in a full sprint, making sure that we're doing everything we can to have new ways to prevent, detect, and treat cancer through the innovation pipeline, but just as much make sure that everyone across the country has access to the tools we already have and those we develop along the way.
What has been, you've been in this position a couple of years, what has been frustrating? Because obviously there's been a war on cancer for a long time, but there has been, there've been more progress in combating other diseases. What have you learned in the last 2 years?
Yeah, I think we shouldn't overlook the fact that we have made a lot of progress in the fight against cancer. For example, the cancer death rate, that measure we're using, decreased by about 25% over the first 2 decades of the century. If you pull in the 90s, it's by about a third. That is amazing progress. But we're going to have to see an acceleration of that improvement. We've seen some of that acceleration happen since 2016, but there's still areas where we know we're not making enough progress. Just to name a couple, in the prevention area, for every tool that the great researchers and clinicians are talking about on the treatment side, we can do way more in improving outcomes from cancer, or even preventing people from getting cancer in the first place, through a focus on smoking cessation and nutrition and lifestyle, and not put it on the individual, but make sure as a society we're really supporting these lifestyles that are prevention minded in general, and specifically cancer prevention. Early detection is another huge area where we can make progress. We lost a lot of ground during the early days of the COVID-19 pandemic, where we had millions of missed screenings. We are starting to get those back, but we need to really accelerate the access and ability for people to get recommended cancer screenings, because we know if we catch that cancer early, the outcomes are much likely to be better.
The president has said that everyone needs to be involved in this massive endeavor. Now, post-COVID, can you talk a little bit about that, whether that's stakeholders, whether that's patients, and obviously the White House has organized this massive effort across government. I want to ask a couple questions about that later. But, how can people get involved? How can they help the White House? Because obviously we live in polarizing times. Cancer affects every family. I know that led to obviously the tragic death of Beau Biden. What can people do that are watching this right now?
Yeah, I mean, I'll start where your question ended, in that, yes, the president and the first lady, this is personal for them because of their experiences, Beau and other family members. But it's a presidential priority and a White House initiative because it's personal for nearly every American. This is an issue that crosses lines, and we've seen really robust bipartisan support for research and access for decades, and we're hoping to really build on that. But for individuals, there's a couple things. One, like I said, we can do a lot on prevention and early detection. And while we as a government should make sure that every barrier could possibly be removed is removed, affordability and access and time off and making sure people have travel and or that we're bringing early detection to them, that's on us. But we need people to meet us part way and to make sure that they're not delaying and that they're taking care of their health early, because it could have such a great impact on their ability to prevent or to survive a cancer. And then we've benefited from a lot of partnerships, additional partnerships from the private sector, academic, nonprofit, who have been inspired and really lined up behind President Biden's vision for this Cancer Moonshot. And we've been able to use the Cancer Moonshot as a platform to highlight really great work, because while the federal government can do a lot, that last mile and that access and understanding of communities and really reaching people and driving innovation to as many Americans as possible is really a whole of society effort. And so folks can continue to share their stories, continue to share their ideas, their new actions and collaborations through whitehouse.gov/Cancer Moonshot.
As far as equity and access, how is the White House and federal agencies ensuring that the people getting the treatment, it's done in a fair way and it's accessible to the most vulnerable populations?
Yeah, I mean, we want to make sure that's true for the entire pipeline, from preventative care and early detection all the way through treatment and survivorship. And so we've announced new initiatives. The president from the beginning of the administration and even prior has worked really hard to ensure healthcare coverage is reaching as many Americans as possible because of the Affordable Care Act. Preventative care is covered, and early detection is part of that. So we really are trying to bring the system to as many Americans as possible. For example, there was a new program from HHS that partnered federally qualified health centers that often serve low-income and medically underserved people across this country to National Cancer Institute comprehensive cancer centers, some of the best of care in the country. And they're going out and they're making sure people are getting cancer screening early, but there's a navigator, someone to walk with them if something is found so that they get to diagnosis, they get to treatment. We have the pipeline really connected. It's just one example. I'd say the Department of Veterans Affairs and the Department of Defense, since they run health systems, have been a huge part of what we're doing and making sure that everything is reaching their communities across the country.
How much of the Cancer Cures Act, which the president, now president, had a lot to do with, how is that implementation going?
Yeah, I think we're about 7 years out, and I think it's made a huge impact. For example, and just to remind folks, the Cures Act was signed by President Obama in December of 2016, really at the end of the administration. But it was a hugely bipartisan act that brought additional funding, $1.8 billion for the Cancer Moonshot at the NCI, the National Cancer Institute. It created an oncology center of excellence at the FDA, which was meant to streamline and offer a place where both researchers and companies and patients can get direct access to information about what's coming up through the regulatory pipeline and what trials might be available. So that's made a huge difference. And then the other part that impacts beyond cancer, but has had a huge impact on the advances we've seen in cancer is people getting access to their health information, decreasing those barriers for people to be able to access their own information and then seek that second opinion or that trial, really be their own advocate in finding the care they need.
Regarding, there was, as you know, a deal in Congress with the debt ceiling. Are you confident there was a bipartisan compromise? It's gotten through. Are you confident that still the funding is going to be there? Because there have been some conditions which were attached on spending. Are you confident that the cancer research is going to get the money it needs?
Well, listen, like I said, there's been really robust support for bipartisan support for cancer research in the past. We don't think that's going anywhere. The deal that was reached enabled us to move forward, enabled us to maintain priorities. And for this president, cancer and this Cancer Moonshot is a priority.
Danielle, thanks for joining us. Really appreciate it. You've got a very important job. We wish you the best of luck.
Thank you so much.